Welcome to Pharmacy Prep. Today I'd like to present you top 5 healthcare professional jobs here in Canada. So during this pandemic, we all have seen several images or we have experienced how these brave healthcare professionals have saved several lives. And also we have seen severe shortages of these healthcare professionals and also severe shortages of the ICU, intensive care units beds, and also there are shortage of the human resources in those ICUs or emergency medicine. So therefore, I like to discuss today about this top 5 healthcare professionals and also their salaries. And since these healthcare professionals had a severe shortages, and that also tells that in the near future there is a huge potential to have job growth on those professionals. So here are those from those top 5 healthcare professional. Here is the number 1 healthcare professional, that is nurses. Well, I have made those list of the top 5 based on the number of jobs available in those healthcare professional settings. Number 1. So according to the Canadian Institute of Health Information, this is before pandemic. In 2019, there were about nearly 440,000 nurses. Like I'm talking about before pandemic, 440K nurses. So this is in 2019, and from those nurses, that's the number 1 highest number of healthcare professionals are this one. So therefore, I grade them as a number 1. That means among all healthcare professionals, that's the highest number of healthcare professionals. That is close to 440,000. So from those nurses, actually there are within the nurse profession, nursing, there are several type of nurses. The most common type of nurse, which is also called registered nurses, or also known as RN, and there are nearly about 300,000 nurses from these 440 or RNs. That's the biggest number 1 of all types of nurses. So the second type of nurse is called licensed practical nurse, LPN, and that is about close to second highest number of the types of nurses. And then third one is nurse practitioners. Nurse practitioners are higher types of nurses. So they're number in terms of number 3, in terms of the numbers. So these 3 types of nurses are the most common type of nurses. So from these nurses, let's look at their salaries. So RN makes around 72K to 95K registered nurse salary. I know these numbers are given based on the recent information. The information for source of information is presented right under this description. You can find the link and directly you can see that, because there could be some changes in this number that can likely can increase those numbers or changes, because this information always updates and changes over the time. So therefore, recent information can be found in the description and find those details. However, according to these numbers, RNs makes around 72. So generally, if it is the entry level, just got it finished their BSc nursing, and now they started working, obviously have no experience, likely they'll start from this salary. And those who have several years of experience, and also they do multiple place work, and most of the nurses, they work in hospitals. And however, those who work hospital plus also additionally other places together, maybe they may make the higher end salaries. Or there could be nurses who make more than 95K as well. This is just an average range. So that means whenever you see a nurse doesn't always think that she makes 95K or 70K like that. We cannot label them. However, it depends on their hours and how much experience, and also places where they work, like most of this works in hospitals and also long-term cares and various other place settings of pharmacy for the practice settings. So in this case, the second type of nurses are licensed practical nurses. Like in Ontario, licensed practical nurses, also known as RPN, which is a registered practical nurse. It is their same thing with two different names. However, they make less than RN. Obviously, they make around average salary is 52K to 68K. And they're very hardworking professionals. They do work in various long-term cares and also for hospitals, and also mainly they work in senior care and gynecological care and children pediatric care. Those are specialties. Mainly they do focus on them. However, the most experienced LPN can make over 68 or close to 68, and the entry level can be started around 45 to 50 salary can begin. And then the third type of the nurse, that is called nurse practitioner. Nurse practitioners are highly educated. They do have additional education after finishing their RN or start having a license. They have to go through another couple of years university program to become a nurse practitioner, and they do go through several professional exams to become it, which is almost they are categorized into provider categories. Provider categories are like provider categories of healthcare professional include physicians, um, and, physician assistant. They are called provider category. So they comes under provider category. So that means they also can write a prescription. They can prescribe drug to patient, and they can assess, and they can diagnose the patient, and they can prescribe it. So they do have obviously higher salaries. Average is 99K to 123K. That's the salary of NPs. So this is the here just an image of the Sunnybrook Foundation. So they do have a great job of people donate them to help them to improve the quality of nursing care. So definitely you can think of that. Here nurses are getting ready in Sunnybrook to waiting for the patient to arrive in the beginning of those COVID situations. So next number two is the physicians in Canada. So physicians in Canada are the second highest number of healthcare professionals. So according to the CHI, which is a CIHI, when I say CIHI means Canadian Institute of Health Information. That's a nonprofit agency, federal agency that gather the all healthcare information. So therefore, any information that is published from them, I consider them as a credible information. So this is the information from them. So according to them, 2019, there were about 91,000 physicians were in Canada, 91,000. And of those 91,000, 92% they work in urban cities. That means cities like Ontario has a big city such as Toronto, Mississauga, or Vancouver City, or Calgary, or Edmonton, or obviously Montreal and other those big cities. You will find them most of the physicians. Well, obviously, you know that you often hear about the physician salaries, that they have a huge, massive salaries. That is true. You may wonder how much salary they are getting. Let me see. Because among the healthcare expenses, the third most healthcare expense goes to the physician salaries in the Health Canada. That means most expenses. Among them, third expenses after hospitalization and medication costs, the third expense for the healthcare system in Canada is for physician salary. So average gross payment per physician is starts from family physician average. This is the average, okay? Don't think every physician makes around 280K, or especially they can begin with 200K and they can be senior physician with experience or having multiple practices, then maybe they would be making around 280K. However, those are specialists or specialties experiences, they make much more than them. And obviously the most paying physicians are the one who have a surgical experience. They need to have a good surgical skills to make sure that to make those kind of money. You may wonder, that in like a couple of years ago in Quebec, there are physicians, they protested against the raise of their own salary. And that is very interesting. I really feel like they are very highly ethical professionals. They do protested against their own salary. I mean, they said that they want to have a fair with other healthcare professional equal salaries. So therefore, they didn't like to have a huge salaries. So this is one of the salaries information for the physicians. So here I have a quick image on the University of Toronto emergency medicine, and especially here I'd just like to address you a few points such as insulin 100. You know, insulin was invented right here in University of Toronto in Canada. So the invention of insulin right here in Canada or in University of Toronto is one of the greatest invention of the medicine history, in the history of the medicine. So now it is celebrating, Department of Medicine celebrating insulin 100. That is a good proud movement, because it says here discovery of insulin by U of T 100 years ago is one of the most significant advances in the history of medicine. That's amazing. And few events have transformed the lives of so many people so suddenly and profoundly. Insulin focused the eyes of the world on Toronto and placed us the vanguard of the medical research and treatment. So this is something amazing discovery of insulin 100 um, right here in Ontario in Canada. So let's go back to the quickly back again to the physician salaries, as we talk a lot about physician salaries. However, obviously they do offer a great services to the healthcare system, and especially during this pandemic, there is acute care physicians in hospital emergencies. They have done great, amazing job of doing saving several lives. We always appreciate their hard work on that one. However, in Ontario, there is a list called Sunshine. So sunshine list means there is the government employees who make more than 100K salaries per year are considered as sunshine list employees. So often you will find there are many doctors or many physicians are found into the list of those who earn more than 100K salaries per year. So here is the 2021 2020 sunshine list. Those who are interested to know who are those public employees who made more than 100K, those who are interested to know, then you can definitely find that one. So here is how you hear a lot about those salaries. But again, salaries is just can be a motivation for someone to become a great healthcare professional. However, many healthcare professionals, regardless of salaries, they do a great, amazing job of offering a great healthcare service during this pandemic. So the next, number 3 healthcare professionals I placed here as a pharmacist, pharmacy team here in Canada. So the reason for selecting pharmacy here is they have done amazing job during this crisis of pandemic, and there is a huge growth potential for their jobs in the future as well. So in this case, there are, as per the CIHI, which is a CHI, according to them, in 2019, there were about 43,744 pharmacists in Canada. And there is a job growth rate. This is the job growth. There is about 2% predicted. However, this was mentioned before pandemic. Since this is mentioned before pandemic, this job growth rate could change in the near future because of the changes or reforms that are necessary in during this because of this pandemic. So among those pharmacists, let's see how much salaries they make and who are included in the pharmacist team. So pharmacist team include pharmacist and pharmacy technician. These two healthcare professionals are called regulated healthcare professionals. Regulated means they do have to have a license to practice. So even pharmacy technicians also require license to practice. So the licensing is a requirement for practicing as a pharmacy technician. I know there's another healthcare professional that is called pharmacy assistant. However, pharmacy assistants are not regulated healthcare professionals, so therefore they do not require license to practice. On top of that, here are those pharmacists' average salary annually, according to the recent talent reports that is a 102 or 102,000 K or 102K per year salaries. That is not bad, not low, or not very high, which is they are very hardworking pharmacists. And and also nowadays, the reason, also another reason why I put them into the top uh, healthcare professionals for this pandemic, because they have been doing a great job. A lot of times we think that pharmacists are generally seen in the community pharmacy, but maybe many of these patients not aware that in hospitals, nearly about 15% of total pharmacists workforce, 15% of them work in hospitals. Basically, imagine in a hospital, patient is receiving some sort of emergency medications and etc. All the medications that are receiving by the patient is provided by a pharmacist, pharmacy team, those who work behind the scene, and they do prepare them and they supply to the ward. A lot of time in wards, patient they don't see them, but those are prepared by them. So also now pharmacy technicians, now they're allowed to give a COVID vaccine. So therefore they do great job. Therefore I place them into the top 5 categories of healthcare professionals. So here the salaries of the regulated pharmacy technicians are around 57K. But again, don't label them right away when you see a pharmacy technician that they make 57K. Depends on the entry level to the maximum experience and also where they work. Generally, most technicians they work in hospitals, because in hospitals, pharmacist and technician ratio is 1 to 6. That means there is a one pharmacist and 6 technicians. Pharmacy technician works in hospital. Whereas in community pharmacy, just 1 to 2. That means there are 2 technicians and one pharmacist. However, more technicians work in hospital settings, so that could be average salary. There could be some pharmacy technician maybe making more than that, or there could be some pharmacy technician, of course, entry level can be a lot less than that. So, however, that's the average number. So I was mentioning to you, behind the scenes, pharmacists, they do a great job in hospitals by preparing medications. Now imagine patient is getting ventilator or patient is going through serious emergency procedures. They require anesthesias, plus also sedatives. All those are prepared in the back of the scene by the pharmacy team. So therefore, they do deserve to be into the list of top 5 healthcare professionals in pandemic. So also here in this image from the University Health Network, Toronto publication, that is really very impressive, and to see how this healthcare emergency team like emergency physician, respiratory therapist, and registered nurse pausing a movement of respect for the patient at the time of the death. Definitely it is a very touching, and it could be very heartbreaking for them to see these images every day in real life when they're working during this crisis of this pandemic. Therefore, I really appreciate for their commitment toward their patient care and also caring for those patients who are arriving to those emergencies during this pandemic. And also, of course, this been going on before pandemic as well. All right, so next, healthcare professionals. I like to include very hardworking professionals, that is called personal support workers. So number 4 is personal support workers. Personal support workers are the greatest healthcare workers, because you will see them a lot of times we ignore them. We basically, and when we get old, actually, honestly speaking, they are our companions. A lot of time, long-term care are mainly most hardworking people in long-term care are obviously personal support workers and other workers who work in long-term care. So, but only sad part is their salaries are not that very high, which is the minimum basic salaries they get it per year, which is average salary according to the current references, that is about 38K. And I wish that they could have a little more better salary than what they have now. I wish that in the after this pandemic, there are some new reforms have to be bring, so that way you can have a more personal support worker, so that way we will not have any kind of crisis again that would happen in the, especially in the first wave. that a lot of seniors in long-term care have suffered and died because of those lack of those resources in the long-term care. So hopefully now near future there should be some healthcare reform, especially human resources reform should be in the place. So you will see there is a huge job growth of personal support workers. More personal support workers are likely possible. So therefore, recently, even those who are international medical graduates who are in Canada have no license to practice as a physician, they can directly even work now as a personal support worker without any training or license. That is amazing. It is approved in Ontario. So you can look at that information. I provided some references into this description bottom below this one video. So you will find that information and you can definitely benefit from that one. So this is about the personal support worker. And finally, the number 5, healthcare professional or healthcare workers who are EMT and paramedic in Canada. So they are amazing because remember, whenever something goes wrong and something emergency happens, first thing we think of what? We think of calling 911, right? So when you call 911, whom do you see? Obviously, first person arrives when you're in the trouble is paramedic. No matter what kind of trouble, is a health trouble or fire trouble, or you had an accident on your highway or any other, or even you have some conflict or any other problem, first person to arrive to rescue you is paramedics. So therefore, they are the greatest people, in my opinion. They are the first people who arrive when you need help. So let's see how much money they make it. Well, paramedics they make not very low, not very high. Maybe entry level paramedics, they make 55K, and maybe senior paramedic, and there are 75K. And there are some paramedics who have a lot of experience, and they are also present in the sunshine list as well. That means some of them may make over 100K as well. Of course, they deserve it because they must be working very hard. Many of them work in hospitals and many of them work in urban places, cities, and very few you will see that in small towns. So these are the number 5, healthcare professional, and their salary details and other information is presented here in the description. So this is all about this number 5, healthcare professionals. So with this number 5, I will complete this video. And for upcoming videos, we have more videos on other other healthcare professionals, and plus also how to become those healthcare professionals right here in Canada, what kind of educational requirement, and also other licensing requirement to practice here in Canada is presented in upcoming videos. So therefore, please do subscribe this pharmacy prep channel to have a more updated and recent updates on those upcoming information. Thank you. Hope this information was useful, and for details about the resources and references, those information presented right here below in the description, and also for the more videos about how to get into those jobs and what kind of educational requirement and what kind of licensing requirement to get those practice here right here in Canada. For those upcoming videos, to have those updates on them, please do subscribe this Pharmacy Prep channel and click on this bell button to have you update. Thank you.